Hey everyone, Dr. Madeline here at Forward Spine Center, and today I'm here with Brooke Noble. She is a registered nurse and women's health coach with a background in labor and delivery and postpartum care. As a FAMM certified practitioner, which you should explain what that is, she integrates fertility awareness and cycle charting into her work to help women not only build body literacy, understanding their hormones, and connecting lifestyle factors like stress, recovery, nourishment to their menstrual cycle pattern. She empowers women to confidently use this knowledge for both natural birth control and optimizing fertility. Thanks for being here.
Absolutely. It's great to be here.
Yeah, it's going to be fun. So let's start out with, I'd love to hear just your story personally and professionally. What led you to this special area of women's health and how you found your niche in fertility awareness?
Yeah, totally. So my story kind of starts back when I was a kid, really with watching my own mom's symptoms of having hormonal migraines. And that was a really hard thing to watch her go through. And it was kind of this cyclical monthly thing. I eventually put two and two together and realized it was kind of a hormone thing. And when I got my own period at the age of 13, I experienced really debilitating cramps. I was in a lot of pain, heavy period. I felt like, okay, my life is kind of over if I have to deal with this every single month. So at this point, I have kind of this scary picture of what hormones are and what they do, but also an insatiable curiosity about the human body and about how bodies work, which led me to go to nursing school and be really fascinated in women's health specifically. I wanted to become a midwife in school, and once I became a labor and delivery nurse, I realized that that was all the responsibility that I wanted. It was very intense, very rewarding. And after working with dozens of women, I really started to, notice these themes and patterns of women suffering. So stories of infertility, heavy periods, uterine fibroids, adverse consequences with being on the birth control pill. Like all of these things started kind of this web of like trying to connect the dots and understand like this collective women suffering. And so I started to ask some deeper questions, like where's this all coming from? And what can I do to help support women holistically? And that led me to become a general, like a nurse coach or women's health coach. And from that place, I found fertility awareness. I read the book, The Fifth Vital Sign by Lisa Hendrickson Jack. I'm not sure if you're familiar with that. And that is where I learned how to track and chart my own cycle. And it opened up this beautiful world of like what's going on inside of the cycle from day to day as I'm experiencing it. And I honestly never look back. It's been 70 cycles, almost 5 years. And I love tracking my cycle. And I learned, through learning about what was going on, it was very empowering to me. And I wanted to teach other women about the cycle. And we'll get into kind of why it's valuable. Yeah. But from there, I certified in the Fertility Awareness Mastery Mentorship, which is a symptothermal fertility awareness tracking practitioner training. And then I just finished an additional training to kind of round out what I learned. And it's been very rewarding to work with women in that capacity for a few years.
And not being afraid of your hormones, but really understanding them.
Okay. Yes. Yeah. That fear piece gradually shifted to a place of understanding and self-compassion. And, my hormones are not perfect. There's not a perfect cycle, but I've learned instead of being afraid and kind of just like, oh, this thing, learn to kind of partner with my body and view my body from a place of its deep wisdom. What are symptoms trying to communicate to me? What is my cycle trying to communicate to me instead of just hating all of it, which is easy to do, right?
And like giving yourself space to understanding it. Self-care. Yeah. So for someone who feels disconnected from their cycle, what actually happens hormonally throughout the month, and why should women really listen to their body and care about these?
Right. Yeah. So we can start with just a little bit of the physiology of the cycle. Yeah. So when I'm talking about the hormone cycle, I'm referring to all of these different hormones that happen in an approximately 25 to 36 day hormone cycle that starts with menstruation. And then in the middle, we have ovulation, so the release of an egg. and then ends with that basically the menstruation starting all over again. So day one of our cycle is day one of our menstrual bleed. So that's day one of our period. A lot of women are aware of when that happens. A lot of women are tracking that already. During that time, our hormones, specifically estrogen and progesterone, are at kind of this all-time low. We're in a place of just kind of quiet, stillness. We're bleeding. The lining of that uterus is releasing, it's shedding, right? And that's what we see when we have that bleed. And then after our menstruation, we move into a time of our follicular phase. That's the second phase. During this time, estrogen is starting to rise in the cycle. This is starting to encourage our body towards that big ovulatory event. If you think of ovulation as like this pinnacle of the cycle, we're moving up towards that. We might start to feel a little bit more energy. That lining of the uterus is starting to build again because of that influence of estrogen. And we might start to see some fertile cervical mucus. So for women who might, notice that there could be a pattern to cervical mucus, they might see maybe on the underwear when they're going to the bathroom or on the toilet paper when they wipe. That's actually a sign of rising estrogen in the body and a sign of fertility in our cycle. So that's phase two. Phase three is our ovulation. So that's when that actual pinnacle event happens, when that estrogen has risen so far that it causes our body to release an egg. And we often will feel that our energy is at our highest. We might feel our best at that time. And then once we have finished that ovulation, we move into the luteal phase. That's the fourth phase of the cycle. That's when the hormone progesterone takes over. So when the egg is released, there's a little capsule that releases progesterone, which is a warming hormone. I call it kind of the mothering and the nurturing hormone, and it reinforces that uterine lining. And it also helps to prepare for pregnancy if conception has occurred. During this time, a lot of women might experience symptoms of PMS. For some women, their experience of this phase is not great because that estrogen has lowered and we have that high progesterone. So that's phase number 4. After that, if we're not pregnant, those hormones lower again. And that triggers our menstrual bleed and our cycle happens all over again.
Okay.
Yeah.
And then you also use, so along with the mucus, because you're really using that, you also use like body temperature, the basal temperature, and then the LH strips as well. Can you kind of talk about each one of those and how that also correlates with the cycle?
Absolutely. Yes. So when we're thinking about kind of the physiology of the cycle, we are tracking a couple of these biomarkers, right? These signs of the body. So the first one is the cervical mucus. And that is cueing us into our fertile days after our menstrual bleed has completed. So as we have rising levels of estrogen, we might see more of that cervical mucus. Sometimes it can have a creamy texture. Sometimes it can be more like egg white and slippery. That's a sign of very high estrogen, very high fertility, and we're very close to ovulation. Okay. So there's different, in different fertility awareness methods, there's different ways to categorize these mucus signs, but cervical mucus is a primary sign of fertility. The next one is basal body temperature. So I kind of talked about that progesterone, right? That's what happens in phase 4, the luteal phase of the cycle. So when our body produces progesterone, it increases our basal body temperature. It has that warming effect on the body. So we can actually track that by taking our temperature every morning. And that can either be through just an oral basal body temperature after we wake up. There's a lot of different femtech devices out there now, like a temp drop device is like an armband that you wear overnight, and that will track your temperature. Other things that women use, but primarily the oral and the temp drop are the ones that I am familiar with. So that allows us to track that increase in temperature after we've ovulated. So it allows us to understand kind of where we are at in our cycle.
Okay.
And then we have our LH strips. So if you're familiar with that, a lot of times it's also called the ovulation predictor kit, an OPK. LH stands for luteinizing hormone, and that's a hormone that has one moment of glory in the cycle right before ovulation happens. If you think of LH as kind of flatlining through most of the cycle, and then we have a big bump in LH right before we ovulate. If you think of ovulation as this growing balloon, LH is the hormone that comes along and pops the balloon and causes the egg to be released. So we have that big surge in LH 24 to 48 hours before we actually ovulate. And we can test that with urine dipsticks. So some of your clients might have used those before. We're dipping and testing. When we get a positive LH, that means that there's a very good chance of ovulation happening in the next day or two. So it's a sign that kind of allows us to know that it's coming.
So kind of using all of these to really get an eye on what your body is feeling.
Yes.
And then correlating your symptoms with what's actually going on in your hormones.
Right. So in fertility awareness, what we're doing is we're tapping into this real-time data that we're collecting daily. There's different methods within fertility awareness. Different methods use different signs. What I teach is the symptothermal method, which is primarily cervical mucus and basal body temperature with optional LH strips if we want a little bit more data. So I teach a bit of a, customizing approach for clients based on what's easiest for them. But yeah, it's important to know that, there's different types of fertility awareness methods out there, and symptothermal is what I teach.
Okay.
Yeah. Yeah. But
I love, especially for someone who's gone through, infertility and then also having children. It's crazy how your symptoms change.
Yeah.
Like I used to get symptoms before my period. Now I get them after my period. But really understanding, well, this is because of this, where I am in my cycle, like what's going on with my hormones.
Yes.
And then how we can use different remedies to actually help with that. Do you also help patients kind of navigate that?
Yes, to a certain degree, I do. So in my FAMM training, we were trained to kind of look at the cycle not only from understanding when we are fertile and when we're not fertile in the cycle, and I can get into that piece a little bit if that would be helpful, but also looking at the cycle as a vital sign. So it has been recognized in medical literature, ACOG, and the American Academy of Pediatrics as a vital sign in helping to evaluate a woman's health status. So different parameters of our cycle, so as we're kind of tracking those different phases, reflect different kind of reflect an overall picture of what the hormones are doing. So if we're struggling with hormone health issues, tracking the cycle can be very empowering to allow us to know, what are our hormones doing, and what needs to be kind of targeted as far as supporting our body.
And this is kind of like the base.
Absolutely.
You have to know this.
And like you said earlier, I think it's very helpful to know, our symptoms that we're experiencing, are those cyclical, and can they be correlated with a specific time in the cycle? For example, PMS symptoms, like I mentioned earlier, very, very common. So if someone is experiencing, say, extreme mood swings, and it, prior to cycle tracking, it might have felt like really random, all over the place, but then maybe they can see, ooh, this is actually happening like 2 days after I ovulate. That gives us more information that we can then share with our healthcare provider, that we can then kind of just like understand our bodies a little bit better to know what's going on.
And then you also have awareness into, one of the big questions is, can fertility awareness actually avoid pregnancy?
Yeah.
Can you kind of talk a little bit about that?
Totally. Okay. So here's the thing. With how our bodies work, I think it's very helpful to have a little bit of this understanding of the anatomy and the physiology before we start using fertility awareness. Women are not continuously fertile. So we are not always able to get pregnant throughout our cycle. There's really good literature, that has kind of proven this 6-day fertile window. So, if a woman has, a 25 to 36 day cycle, there's only going to be 6 days within that cycle that she can actually get pregnant. And that is the day of ovulation, right, when the egg has been released, and the 5 days leading up to ovulation, because sperm can survive in cervical mucus for up to 5 days. So men are continuously fertile, right? They produce sperm every day. And so basically a couple's combined fertility with men's continuous fertility, women's, day of ovulation, that's a 6-day window. So when we are using fertility awareness to avoid pregnancy, we are using real-time data to identify the opening and the closing of that fertile window. And based on a couple's conception goals, they can either try to get pregnant by having unprotected sex within that fertile window, or only having unprotected sex outside of that fertile window. So we can use the method in different ways depending on our conception goals.
And does your cycle change? So do you see that a lot where like it's not always day 11, it's not always day, how much can that vary?
Exactly. Okay, so what you're speaking to there is, there's a kind of a misconception that fertility awareness is the rhythm method, where it's just like, oh, day 6 through 12, I'm fertile. We do not use the word rhythm method in fertility awareness. We're not going off of which days in the cycle we're just labeling as fertile and infertile based on where we're at in the cycle. We are because that fertile window can change. Sometimes we might ovulate on day 12 in our cycle. Sometimes we might ovulate on day 16. You can still use fertility awareness because you're going off of what you are observing in the cycle from day to day to open and close the window. So you'll be able to know, if you ovulated later in the cycle, we're going to wait for unprotected sex until we've confirmed that that temperature has risen and the cervical mucus has gone away. So it doesn't matter if it's later or earlier in the cycle. Once we know how to track and what to track and how to interpret what we're tracking, then we can still open and close the fertile window, even though it does change. There is normal fluctuation for most women. Most women do not have a perfect 28-day cycle, and that's perfectly fine and normal. Our body, in its wisdom, might delay ovulation during times of stress or sickness. Or we might ovulate a little early sometimes, and that's all fine within this world where we're not relying on basically an algorithm or a rhythm. We're relying on what we see and learning to trust the signs that we see from day to day.
What are other triggers can affect your rhythm, your cycle? You talk a little bit about stress.
Yeah.
Being sick. What other what other things can affect that?
Yep. So when I think about the first of all, kind of going off of that with, we might see some delayed ovulation, or maybe we don't ovulate in a cycle. For sometimes women might have what we see as an anovulatory cycle. If the body was under a time of stress or maybe undernourishment or someone was sick, sometimes we miss a cycle of ovulation. And we wouldn't know that unless we were tracking to be able to confirm that there wasn't a temperature rise. So that happens. Other things that can affect our cycle length and different parameters, a big one is nourishment and stress. Okay. So our bodies, in their wisdom, are always looking for a sense of safety. When we have that sense of safety with adequate nutrition, enough sleep, enough rest, and stress relief and connection with community, then our body feels in a safer space to be able to basically procreate, to reproduce, to have a regular cycle. For people who might be under more of that stress, they might be undernourishing, not sleeping enough, that can also be reflected in the cycle with delayed ovulation, maybe no ovulation. I've seen charts, we call it hypothalamic amenorrhea. It's where women are not ovulating at all. And that can be related to stress or overexercise or undernutrition. There can be a lot of things there. But the basic idea being our body will prioritize, our reproductive system only when we're in a place of nourishment and rest and support. Especially for people who might be struggling to conceive. That's a really big part of where we start, are those foundational factors of ensuring that those needs are met first, because that's going to make sure that our body feels in a place of safety to be able to ovulate consistently.
And I love how they're raising awareness about how this is a function of our body.
Yes.
And unfortunately, as women, this is one of the first functions that will be put aside when we're under stress. Like
Absolutely.
I talk a lot about like teenagers, like when they're over exercising, then they don't get their period.
Right.
You know,
right.
and it's actually it's a big red flag that we
Mm-hmm.
need to kind of educate women to be more aware of their body, that the system is the first one to go,
Mm-hmm.
and how that can affect us long term
Absolutely.
if our body isn't cycling every month.
Yes, and that is a really important point. Is there are health benefits to consistent ovulation when we're looking at how that affects our perimenopause and menopause and beyond, midlife, bone density, heart health. Like we need that dance of estrogen, progesterone through the lifespan to set us up for the next life, whatever next season that we're entering in.
Is there also research on like egg quality and like how that changes, like as girls, if they're younger and they're not cycling correctly, how that affects fertility down the road?
Yeah, I'm not too sure about like that jump of time. I would say, for someone who might be looking at wanting to have kids in the future, giving your body adequate nutrition and really focusing on that preconception phase, especially at least 8 months before. It takes about 8 months for an egg to develop. I'd say a year is ideal to be working on preconception support with your partner. That's very, very helpful, because what we're doing is we are tracking our cycle. We're kind of looking at those cycle parameters. We're familiar with when our body is ovulating, when we're fertile, and then there's a lot of amazing resources and literature out there on supporting our body's nutrient statuses prior to getting pregnant, because that's a very energy intensive process. It takes a lot out of us, especially if we're going to, breastfeed afterwards or have subsequent children. So I'm very passionate about helping women understand that, cycling and ovulating isn't just like a thing that happens. It's actually a really key and important part of our health as women that we can support. And when we are, having that healthy cycle, that's a reflection of our health overall.
So hopefully people take this away as like, this isn't just for fertility.
Right.
This is for every woman who just wants to understand their body a little bit better.
Right. Yes.
And unfortunately, like sometimes these birth controls, like you're a nurse, so you have a lot of respect in both areas, but sometimes they can affect how our cycle, so understanding more what your body's doing without the synthetic.
Absolutely. Yes. Yeah. There, in my experience, has been such a beautiful healing process when women start to, we're not just seeing the science, we're actually understanding like what's happening inside of us. And there's almost a sacredness, a beauty to it of, this dance of hormones that when we understand and kind of tap into, it creates this very empowering feeling of like, I can understand that what I'm experiencing from week to week, and the fact that I'm a cyclical being is not a mistake. And I can kind of work with that, in terms of my changing energy levels and needs throughout the cycle. There's a huge component, I think, of connection to our own bodies as women that is very healing, especially in a culture that, is full of distractions and things that would disconnect us away from our own physiology. So that's a huge
part of fertility, stress and awareness. So
absolutely.
As we close up, could you share one clinical pearl, if something really simple but impactful that you hope that people take out of this conversation?
Yeah, totally. Well, we've talked a lot about a lot of different things. I would just say, our curiosity exists for a reason. If there's something in this conversation that has kind of struck a chord, or it's like, ooh, I'm really interested in that, I want to go deeper, I would say just let yourself be free and follow that curiosity. We're not shooting for perfection here, but to be able to allow, yourself to learn about your body in a way that feels sustainable to you. Just our curiosity teaches us a lot of things, and there's a lot to be learned within our own bodies too. So just kind of, I think, in terms of a clinical pearl, it can be very easy to try to outsource a lot of our health to different people, and that there's a time and place for that. But just remembering there's a well of wisdom that exists inside of you, inside of your body, that is just waiting for you to tap into it if you choose.
I love that. Yeah. I mean, as someone, we unfortunately had to go way towards like IVF, which is so much intervention. But I wish I would have known about this to start off with. You can be such a start for anyone who just wants to understand their body a little bit better. It doesn't have to do with fertility. It doesn't, it just, yeah.
Absolutely. Yeah. And you can take it to the nth degree, or you can just learn a little bit. There's so much flexibility there. There's no judgment.
And if someone would like to reach you, how would they get a hold of you?
Yeah. Yep. So my website is coachingfrombrooke.com. I am working towards building a signature program right now that combines everything that I've learned into a course to be able to work with groups of women. So if this is something that someone is interested in working with me, I'd say the best way to get a hold of me now is through my website. And then also follow me on Instagram, Coaching from Brooke. And that's where I'm going to be updating my course. I'm hopeful to have that out by this summer. So you can kind of sign up, to see more of what's going on there.
That's awesome that you can reach so many more people.
Absolutely.
With that course. Yeah. Thank you for being here.
Yeah, absolutely. Yeah. It's been great chatting with you.
I love sharing you with everyone. Yes. Dr. Madeline, thank you for allowing me to be part of your health journey.